Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for this afternoon's briefing. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and good afternoon, everyone. Today we're reporting 4 new cases of COVID-19. One case is in Central Zone and is related to travel outside of Atlantic Canada. Another is in the Northern Zone and is a close contact of a previously reported case. And there are 2 new cases in the Western Zone. They are both related to travel outside of Atlantic Canada. One of them is a student at Acadia University in Wolfville. The individual self-isolated for 14 days as required and then tested positive after their isolation was complete. And they are now isolating again. This is an unusual case, and Dr. Strang will have more details about it. And we have new information today about 2 other cases that were previously reported in December. Both cases were connected to international travel. The individuals isolated as required, but after further testing of those cases, the lab has now confirmed they were both variant cases of COVID-19. One was the UK variant, and the other was the South African variant. The 2 individuals isolated back in December, and their cases are now resolved. But we are looking back at their close contacts to see if there was any spread. I know this may come as a worry. It's our first exposure to this variant, but it is not unexpected. But it is yet another reason why we are continuing to maintain our numbers of restrictions. Gathering limits are still capped at 10. Restaurant and bars will continue to operate under reduced hours, and shopping and retail is still at 50% capacity. We have extended almost all of our public health restrictions until February 7th. But starting Monday, we will ease restrictions around sports, arts, and culture. Sports teams can start playing games, but with limited travel and no spectators. Non-sport teams and arts and theater performances can take place, but without the audience. We are also allowing residents from adult service centers and regional rehabilitation centers to go out into the community and start volunteering and working again. We are lifting only these restrictions because it's important for the mental and physical health of all those involved. I also want to take a minute today to talk about our vaccine rollout. More than 10,000 doses have been administered, and soon the second shot for thousands of Nova Scotians will take place. There's definitely some concern about the Pfizer delay. I had a good conversation last night with my fellow premiers and the Prime Minister, and I want to reassure all of you that there's a lot of work happening behind the scenes to try and secure supply. And I am monitoring the situation, but until there is a level of guarantee of supply, we will continue to hold back our second dose so that we can ensure those who've already had their first dose that they will have their second shot and be fully vaccinated. We do not want to waste any of this precious vaccine. And again, I want to thank all of those who are helping with the rollout of the vaccine and administering the long-awaited shot in the arms of Nova Scotians. To you, Dr. Strang.
Thank you, Premier. Good afternoon, everybody. So just as the Premier said, we are reporting 4 new cases of COVID-19, one in Central Zone related to travel outside of Atlantic Canada. That individual's isolating is required. We have 2 in the Western Zone that are, again, related to travel. Those individuals are isolated or isolating as required. One of them is the student at Acadia that the Premier referred to, and I'll speak to in a bit more detail later on that. But public health is involved in that. We are working closely with the university to identify and test any close contacts. And we have another case in Northern Zone who is a close contact of a previously reported case. One of the cases we reported yesterday was connected to a call at Acadienne de Truro. That came in after yesterday's cutoff for reporting, and even though we included it in the media release, it will appear on our data website and dashboard today as one of our today's cases being reported. So since October 1st, there have been 481 cases in total, and 459 are now considered resolved, leaving us with 22 active cases of COVID-19, and we have 1 or more cases in all 4 health zones. And again, today we're fortunate to be able to say no one is in hospital. We're also confirming today that the National Microbiology Lab identified 2 variant cases of COVID-19 in Nova Scotia, one in the UK variant and one of the South African variant. And these cases, the testing was done in December. And as the Premier said, both of cases were related to international travel and were reported at the time through a normal process, and they were isolating. We know that significant work is happening internationally to better understand the implications of these variants, and we are working closely with the lab to investigate further both of those cases and whether anything more needs to happen. We know that neither case resulted in spread into the community, but in one of the cases, household members were infected. Unfortunately, because as we tested those individuals, there's a very low amount of virus in their samples, and we are unable to send their specimens for sequencing. So it's quite possible that those people that we cannot do the sequencing on may also have the South African variant. It would make sense if their source was a variant case. It's likely they had that variant case, but they were within the household, and there was no spread beyond that household with any of these cases. So I know this news is not one that anyone wants to hear, but as the Premier said, this is not unexpected. It actually shows that our surveillance system works. It reinforces why we need to maintain federal and provincial border measures, and it certainly is another reason of why we need to continue our cautious approach to COVID-19 in Nova Scotia. So I'd like to just give some more context and information on some of our recent cases that we've been talking about. On Wednesday, we reported a positive case from an employee who works on one of the Marine Atlantic ferries on the run between Sydney and Port aux Basques. We know now that there has been a second case of another employee on that shift, that crew shift, and that individual is based in Newfoundland and is a Newfoundland COVID case. We are working closely with Marine Atlantic and Public Health in Newfoundland, and we've been conducting testing there's 2 crew or cohorts of different shifts of the crew that we have been testing. And of the 60 crew that are tested, all the test results are in, we've only had the 1 additional case. So 59 of the 60 that we've tested are negative, which is very good news. Those are the most likely because of their close exposure to the original case. It's other crew who are most likely to have been infected, and only 1 out of the 60 has been. We are doing public notification of possible exposure on multiple ferry crossings, and that has been sent out by Public Health in both Nova Scotia and Newfoundland. We also are working with direct distribution of that notification to truckers, because they're a main component of these ferries, through their employers and through the Trucking Sector Council. And we're asking all those people who are on board those number of crossings to come forward and be tested. But the fact that we've had only 1 out of 60 of the other crew test positive, it gives us some comfort that the public, who would have been less likely to be exposed, not that we don't need to follow them up and test them, but it's lower risk that we're going to see further cases from this ferry. Based on our investigation to date, the Acadia University student, we know that they did complete their 14-day quarantine period as required. However, late in their quarantine, they became infectious, and after their quarantine was over, they went and got tested, and they're now back in quarantine or isolation now because of their illness. So they were after their 14-day quarantine, and they were on campus attending classes as they were allowed to do. So Public Health is investigating, and we are working with the university to arrange testing for anybody who would have been considered exposed in any of the classes that individual attended. And anybody who's identified as a close contact will be tested, isolated, and tested as our normal protocol. I want to emphasize the details of that case because we've already gotten questions. Well, how could somebody under quarantine, how could they then go on to become infectious if they were stuck with their 14-day quarantine? It's simply the fact that no one measure is perfect. Quarantining people, in this case, he became infectious towards the very end of his quarantine period. The fact that he was out and about doesn't mean he didn't comply with what he was required to do. Unfortunately, he went and sought testing as soon as he felt that he was developing symptoms of COVID. And in terms of the student who tested positive from Acadienne de Truro, we now know that this case is connected to a previously reported case, and that student is now isolating. The school has been closed to allow for testing and contact tracing and cleaning, like we do, like we did with all schools in the fall term. And the school is expected to reopen to students on Wednesday, January 27th. And in the meantime, the students are continuing to learn from home during the closure, and the families who have children attending that school will receive an update through the school on Tuesday, January 26th. Let me move on to where we're at with testing. Given that the wave of university students returning is starting to dwindle, we will be refocusing our efforts on pop-up testing in university communities, just as a way to make sure that we're on top of any potential COVID activity that may have resulted in university communities from students coming back. And so we're still encouraging, there are very small numbers of students who may still be coming back, and we'll certainly continue to work with universities to make sure those individuals are quarantined and tested. So we are having pop-up rapid testing clinics at Dalhousie University today and tomorrow, and up in Cape Breton University on Thursday, January 28th. And we were just recently at Acadia University as well, and we're certainly plans in Antigonish, and we'll continue to focus our university communities, if I can call them that, will remain a focus of our pop-up testing. So you can find more detailed information on exact location, timing on all the pop-up clinics at the Nova Scotia Health Authority website. And it's important that while we're focusing on students and university communities, that the pop-up sites aren't restricted just to them. So and if anybody comes and wants to get tested, we will test them. There's a few groups that can't be tested there, though. So if you are under 16, if you have symptoms, if you're feeling unwell and have health symptoms, if you've traveled outside of Nova Scotia, PEI, and Newfoundland, or if you've had a potential exposure or been at one of the the locations that are identified through our exposure notifications, or if you've been in contact with somebody who is a known case. In any of those situations, it's really important that you actually have a PCR test done through one of our primary assessment centers. But if you're not in one of those categories, and if you feel like you want to get tested, whether you're a university student or not, you can certainly be welcome to come with one of those university pop-up centers. So we still have our symptomatic and asymptomatic testing streams through our primary assessment centers. And I'll go through it once again. It bears repeating that if you feel unwell in any way, do the online COVID self-screening and get direction on testing. And even if you don't have symptoms, we welcome you and encourage you to get tested. And this is most important for people who have a lot of interaction with others, whether it's because of your job or your social activity. If you're around lots of other people, we encourage you to get tested on a regular basis. So for today's vaccine update, at the end of the day yesterday, we had administered 10,575 doses of COVID-19 vaccine, and then 2,705 of those were second doses. Another shipment has arrived this week from Pfizer and has already been distributed to our hospital-based centers at Valley Regional and Cape Breton Regional Hospital. Unfortunately, we are not scheduled to receive any Pfizer vaccine next week. but the first week of February, we are expecting to receive limited amounts of Pfizer and our usual shipment of Moderna in that first week of February. And then again, the last week of February, we're scheduled to receive another shipment of the Moderna vaccine. But we have no certainty of vaccine delivery beyond these times, and we're using that information that we have as part of our planning, but we do not have a guaranteed supply. We only get that guarantee about 2 weeks before we can expect the shipments. So it's an ongoing, we plan and we hope to get the vaccine, and as you've seen, there's a lot of variability, and so that is why we have built in the flexible processes that we can manage our distribution and our vaccine clinics in anticipation of decreases or even increases. So one day we turned around and said we're going to get extra amount of vaccines, we have a process that we can rapidly accommodate with that extra vaccine and make sure that that goes into arms very quickly. So we have concentrated on building flexible processes. So I know that there's lots of questions about what the Pfizer delay, the short-term delay, will mean to our the rollout plan. Everything we are hearing through our federal colleagues that Pfizer remains committed to making up the remaining doses later in this first quarter of 2021. So at this point, we're not anticipating any changes at this time to our 90-day plan. It's just within that 90-day, we're going to have to be flexible and less vaccine right now. All expectation for those delayed amounts to come later in February and March. And in terms of our upcoming clinics, we have clinics planned, healthcare worker clinics planned ongoing in Truro, Halifax, Cape Breton, and in the Annapolis Valley. And we have vaccine for limited numbers of long-term care facilities in both Central Zone and Eastern Zone, and we'll be continuing vaccinating next week. We are working with the facilities to determine the exact schedule, and that information will be able to communicate more specifics on that next week. And I know there have been some questions and concerns, both nationally and locally, about potential vaccine waste. One of our priorities in our vaccine program is to ensure that there is as little wastage as possible. So I'm pleased to be able to say we were tracking the number of doses that are unused, and to date, out of the over 10,000 doses that have been administered, only 0.3% have been what we would say considered wasted because they haven't been able to be used during the allotted time. Once they're thawed, you have a certain number of hours before you can use them. So I think it's in reality, it's I think 28 or 27 doses. So 0.3% wastage, I consider that extremely good out of 10,000 doses. And we do know our focus has been sometimes we have, people make appointments and at the last minute they can't show up or for some reason, as much as possible, we focus to make sure that vaccine goes to the next available person to minimize the amount of vaccine that's left over at the end of the day. Last week, we put out a call for help from volunteers at our upcoming community clinics as we start to plan those for the phase 2. And since we made that call, in just a few days, we've had 450 applicants, including 200 healthcare professionals, who are able to give vaccine. They're willing to come out, volunteer, and come out of retirement. So yet again, another example of how Nova Scotians, every time during COVID, we ask for help. Nova Scotians turn up and offer to take care of each other in so many ways. So thank you for all those, and that call out for volunteers is still there. And that if you want to volunteer, you can go on the Nova Scotia Health Authority website again and look under COVID immunization volunteers, and there's a specific section both for non-healthcare providers and for healthcare providers. Before moving away from vaccines, last Tuesday we said that last briefing we said we'd be increasing the frequency of our reporting on vaccine numbers. So last Tuesday we started reporting daily COVID vaccine doses, and that will continue into the future. And once a week, every Tuesday, we'll be providing a much more detailed breakdown of data around vaccination. Moving on to restrictions, and I know many folks are anxious to hear an update of where we're at. As the Premier has said, we continue our very cautious approach, and the current restrictions, which expire just before midnight on this Sunday. Starting Monday, we will be remaining status quo for 2 more weeks at least, with 2 exceptions. The first exception, participants and officials in organized sport and the arts and culture sector will be able to gather now in groups of, starting on Monday, in groups of up to 50, up from 25, without social distancing. This means that athletes will be able to continue to train, but then now be also to start to, or restart, games and competitions. And for artists and performers, as of Monday, they can continue to rehearse and hold classes, but now they could actually stage performances and virtual performances. For sports, games, and competitions, they can happen within their regular competitive schedule, but tournaments will not be allowed. It's important to clarify that any sport competition that brings teams together or individuals that don't regularly compete against each other, we're not allowing that. And so things like provincial championships that bring teams from across the province together will not take place under the current restrictions. Tournaments involving teams that do not compete against each other in the regular competitive schedule will also not be permitted. However, for individual sports like wrestling, archery, or cross-country skiing, meets as part of their regular schedule would be allowed. The whole point is we're allowing competition in areas of the province where where they regularly compete against each other on the normal basis. And if there's individual sports where they have to travel to have any kind of competitive opportunity, we're allowing that within a regional area, so individual sports like wrestling or gymnastics can continue. But bringing large numbers of teams together from across the province into large tournaments, it will not be allowed to happen at this time. We have worked closely with Sport Nova Scotia to develop the details of this, and they have additional information and clarity about what is and isn't allowed in the sports sector. So I would encourage teams or families or individuals who have questions to go to the Sport Nova Scotia website. We've also had conversations with the Nova Scotia Secondary School Athletic Federation, and they will be allowing normal regional play, but they will not be having provincial competitions or tournaments. So the goal is to maintain as much consistency as possible within the groups that we allow to get together, competition, league play, and performances. But at this time, we are not allowing spectators or audiences, whether it's for practices, games, or performances indoors and outdoors. We're not opening up gatherings at this point in time. We will recognize the importance of sports, arts, and culture for physical and mental health, and we're opening those opportunities somewhat, but we're not able to introduce crowds or spectators into those opportunities at this point. It's part of our cautious loosening of restrictions, but at the same time remaining vigilant in the areas which can drive transmission of COVID, which in many of them are social gatherings, and audiences, spectators are part of that. We'll continue to follow the epidemiology like we always do, and if and when we're able to further open that up, we will do so. But it has to be at a time and place where we're safe. The second thing we're changing is we will be allowing residents from adult service centers and regional rehabilitation centers to go back into the community to volunteer or work. We know that the ability to contribute outside of these centers is extremely important to the health and well-being of these residents, but we've needed to wait to make sure that it was safe for that to continue. Other than those two exceptions, we continue to ask Nova Scotians to comply with all the existing restrictions. So it's still up to 10 people in family and social gatherings. The only type beyond those households, family and social gatherings, the only other type of gathering is for faith gatherings and wedding and funeral ceremonies. No other gatherings are allowed. Retail spaces and fitness facilities and studios are at only 50% of maximum capacity. Restaurants remain, service has to stop at 10 p.m. and they have to be closed by 11 p.m., restaurants and licensed establishments. So for people who are looking for more information, reminders on those, if they go to novascotia.ca/coronavirus, all the information on restrictions is there. So these new restrictions will come into effect Monday, January 25th and last until February 7th. And I recognize that while some people have been looking for a greater loosening of restrictions after getting through the holidays, and we're low and stable, we need to recognize that we are still in the middle of a severe second wave that is all around us, including our closest neighbor in New Brunswick. New Brunswick has shown how COVID can escalate very quickly and how hard it is to regain control. Also, in many ways, the winter months are the hardest for COVID control, as this is when we spend the majority of time indoors. We know every winter is a hard time for respiratory viruses, so we have to be extra careful at this time of year. We've already talked about the increased vigilance that our news around our COVID variants requires, and we're still early on in our vaccine program, and our vaccine supply remains somewhat fragile. So for all those reasons, we're choosing to maintain the process that has gotten us to where we're at over the last 10, 11 months. It's gotten us to the place where you may or may not see it, but I certainly see it now, that national media is people, and even internationally, are looking at Nova Scotia and asking the question, how have we been so successful? And we know how we've done that, but we can't give up on that. We need to continue that to get us through the coming weeks and months. And we make our decisions on restrictions based on our key priorities, which are keeping our kids in school for learning, development, and socialization, for allowing social connection, but doing that in a safe manner through a consistent small social groups, allowing careful visits for loved ones in long-term care facilities, and creating conditions that allow people to be physically and intellectually active and connected in their communities, but in a safe way. So those are what drives our decision-making, the epidemiology and those priorities, and it's why we must continue to, again, with a slow and cautious approach. And we will continue the process of every 2 weeks looking at the epidemiology and saying, where is it safe to go next? Let me turn to a little bit about our New Brunswick-Nova Scotia border. There are a lot of questions this week about that. With the severity of our second wave and the impact it's now having in New Brunswick, as folks know, we reinstated restrictions on our border with New Brunswick on January 9th. People who travel from New Brunswick to Nova Scotia are in general subject to the same rules as anyone else. They must complete the Nova Scotia Safe Check-in form and do their 14 days of self-isolation when they arrive in Nova Scotia. Having said that, we recognize that there are many people who live in Nova Scotia or New Brunswick and must frequently travel between the two provinces. In the first wave, schools and many businesses were closed, so this was a bit easier to manage. However, this time we have schools open, many more businesses open, and so aside from the people who are already exempt under the order, very specific groups, there are many more people now needing to travel regularly between the two provinces, and there are also people who have to travel occasionally for things that are necessary and things that they cannot do virtually or online. So we need to let this kind of travel happen without imposing a 14-day quarantine. Otherwise, it becomes completely unmanageable for people to do what they need to do in their regular lives. And we always try to balance our COVID precautions with allowing things to happen as much as is safely possible. So to provide clarity and establish public health measures for safety, we've developed a travel protocol that is specifically for people traveling between Nova Scotia and New Brunswick, and for those who don't or have to quarantine. So if you need to travel on a regular, ongoing basis between the two provinces for work or for school, or if you need to travel on a one-time or an occasional basis, again, to accomplish something that's essential for work, school, or another reason that cannot be done virtually, then you have an exception from the quarantine, but you're expected to follow the travel protocol that will minimize the risk of you transmitting virus or being exposed to the virus by limiting your exposure to others. While you're in a neighboring province, so if you travel from Nova Scotia, I'll use an example, we have students who travel up there maybe one day a week to go to school in New Brunswick, the post-secondary institution. While they're doing that, or people, there's people traveling to drop off a student in a New Brunswick university. The protocol requires them to avoid contact with other people or avoid close contact, to use contactless service, whether it's drive-through food or making sure that your contactless payment for gas. If people have to stay overnight, they need to isolate in their overnight accommodations. And when they return to Nova Scotia, you need to continue avoiding close contact with others, minimizing travel outside your home or your accommodation. And we're encouraging people to take advantage of our asymptomatic testing stream to get tested in the first day or two when they're back, and if they're here for more days than that, on day 6, 7, or 8 to get tested again. There'll be more details on this protocol. It's been posted this afternoon on our website, but I wanted people to understand that recognizing that the many and frequent interactions between Nova Scotia and New Brunswick, we needed to find a way to allow those to happen as safely as possible, and so we've developed this protocol that if people aren't or are exempted from quarantining, and for the rest of Nova Scotians to know that it's not that we're just saying you don't have to quarantine. We're putting the privilege of not having to quarantine comes with the necessity to do a whole bunch of other COVID protocols to minimize the chances of transmission of the virus. To end up, I want to mention that, or come back to one of the priorities that I've talked about previously, is about people remaining physically active. It's important for our overall health. Physical activity is good, both not just for our physical health, for our mental health. And I want to take a moment to acknowledge the efforts of both the Gym Owners Association and the Ski Hill Association. We've been working very closely, folks in government, with both of these groups to ensure that Nova Scotians can get the most out of their local fitness opportunities and be out, if you're a skier, be out on the ski hills, while these facilities are adhering to all the COVID-19 public health measures. Our occupational health and safety inspectors have conducted a significant number of site visits and are seeing a very high compliance, both in the fitness industry and with our ski hills. So I want to commend and thank these industries for their willingness to work with us, to apply and ensure that while they're providing opportunities for Nova Scotians for physical activity, they're doing that in a safe and manner that contributes to our overall COVID response. So over the next couple of weeks, as I've said, we'll continue to monitor our where we're at and continue to look at our approach and the necessary restrictions. What we're doing right now does look different than it did in June. In June, if you remember, as we were reopening, everybody else around us was also reopening because everybody had low COVID. This time, with the second wave, we have to be extra cautious because there's a significant amount of COVID activity around us. As I said, we need to continue to focus on what's gotten us been successful so far. So I'm just going to remind people again that we need everybody to follow all the public health restrictions and everything you do, all the necessary protocols in your own life. Washing your hands frequently, maintaining a safe physical distance, wearing your mask where it's required, and even beyond that. Masks are required in indoor public places, but it's still a good idea if you're in a private place, that you're around other people, especially outside of your household. Masking is a good idea. If you're in an outdoor public place where there's lots of other people around, masking is also a good idea. It's important that continue. If you're not feeling well, stay home and do the online assessment for possible testing. Keep your social gatherings in small, consistent numbers. And as we've got now much more access to asymptomatic testing, consider making that a regular part of your life as well. And we will continue to evaluate the epidemiology and look at the opportunities where we might be able to loosen restrictions in the coming week. But again, I can't say it enough. It's important that we continue to all work together, maintain our vigilance, focusing on protecting one another, protecting our families and our communities. Premier.
Thank you, Dr. Strang. Tina, over to you.
Just a reminder, we'll take one question and one follow-up from reporters on the phone in the allotted time that we have for today. We'll start with Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. I'm wondering, you say that with the two variants that were confirmed in December, that there's been no evidence of community spread with either case. How certain of that can you be, given that the main characteristic apparently of these variants is that they spread rather quickly? Presumably, these people would have had to travel within the province at some point, either through an airport or to their actual residences. So I'm just wondering how certain you can be that there's been no community spread at this point.
So two things. We continue. We're where it's appropriate. We continue to send samples into the national lab, and so we're just our initial. These are the initial two cases. I expect we may well see more from travel related. But we've looked closely. We went back and looked closely today at both those cases. As I said, the one case was an international traveler who went directly into isolation by themselves with no contact with anybody else. The second case, there was, it was allowed contact within their household. When we did and so there were some other people in their household who became infected and were tested and positive. When we're doing the contact tracing of those secondary cases, there were nobody else that was, any of their close contacts out of the household would have been tested, and we got no positives from them. So we know that we didn't, beyond the household of the second case, there was no spread of COVID virus because any close contacts all tested negative. So that's the basis on what we're saying. There's been no, from neither of the cases was there a spread of COVID virus in general. And so if there hasn't been spread of the COVID virus in general, we know there hasn't been spread of any variant strain. But we're continuing to do our surveillance to detect other possible introductions of the variant strain here in Nova Scotia. It's again the way we control COVID in general is exactly the way we control any of the variants.
Go ahead, Keith, with your follow-up.
Is this now the biggest threat, though, to our numbers in terms of the fact that we know we can get it? We have had two cases, and basically it's even more virulent in terms of the way it spreads, despite the fact that we've got a mini explosion next door in New Brunswick.
Yeah, I mean, internationally, they're still looking at the evidence on increased virulence is based on what's called in vitro studies, or studies with the virus itself. Certainly, some of the epidemiologic patterns around the world are concerning. That certainly the UK strain may be, emphasize may be more infectious. But I come back to the point that it doesn't, regardless of which variant it is, which strain of this COVID virus. The way we control it is all the steps we've been taking all along, starting with both federal and provincial strong border measures, everybody following the COVID precautions, and us having the level of restrictions we're having. So the variants don't require us to do really anything different in Nova Scotia. They're just a reminder of how we need to stay strong and vigilant in doing what we're already doing.
Next, we'll go to Alicia Drouse from Global. Go ahead, Alicia.
Thank you. Just to follow up on the variant strains, can you give any indication on how many other test results we're currently waiting on for the variant strains that we sent to the national lab?
I think there's a range of 20 to 30 that they're waiting. The lab is looking at waiting results to come back. We are submitting batches of samples every 2 weeks that go into the national lab for strain identification. And how we select those, it's just work between public health and the lab. Certainly when we have, a portion of international travel cases are all being sent in. And if public health, if we're concerned about circumstances around a case, whether it's significant numbers of contacts who are testing positive or people that have very short incubation periods, those kind of things. As we look at individual cases or groups of cases, we'll ask the lab to make sure that they submit those specimens from those cases as part of their regular process.
Go ahead, Alicia, with your follow-up.
And you had mentioned that you had put out a call for volunteers for the community clinics that will potentially be starting in a couple months for vaccination. I'm just wondering at this point, do we have enough resources to do this more mass vaccinating, or how many volunteers, I guess, are you looking for?
So we're in the middle of, or not in the middle, even just really getting into the detailed planning of, again, those clinics we're not going to need them or not have vaccine supply to actually be able to use that model of clinic delivery until late April into May. So we have time to plan. We're just getting into that detailed planning in general. So what we're doing right now is asking people to put up their hand to say, yes, I'd be willing to participate when I'm needed. And that helps us out to get those pools of people, along with all the work we're doing around a range of regulated health professions, looking for people who have the skills that we can already know how to vaccinate or can be easily trained how to vaccinate based on their underlying skills. So we're in the process of building these pools of people that once we get into the detailed planning of specific clinics, we'll have a much greater understanding of exactly how and how many people we'll need for, in each clinic.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thanks, Dr. Strang. I'm wondering, in terms of the student at Acadia you're talking about, how significant or unusual a result like that might be, and how, if at all, that might inform the way you're looking at how testing and quarantining with university students is handled in the future.
So it's not unusual. Most people, again, the average time for somebody becoming infectious after being exposed is around 6 or 7 days. But certainly it's not unheard of at all that's in some people that takes longer, day 10, 11, 12 even. It wouldn't really change our approach. We know that any one single approach is not foolproof all in and of itself, and that's why certainly when universities we had quarantining as our main focus, but also bringing in testing. And those two, and you may have, even you use both of those, there may be a few cases that you miss. Our goal is not to have zero COVID, however, through any of our interventions. It's to have low numbers of COVID which are low enough that we can manage closely, and this is what happened in this case. We've had, almost, I think, about 4,000 university students come back after Christmas, maybe off in the numbers a little bit. So out of those, we've had a number of positive cases, all of which up until now were appropriately isolating. So out of all that mass number of students, I think I consider it still a success that at the end of the day we have one student who maintained his quarantine, but simply because of the dynamics of their specific infection, there were some other people exposed on a campus. And the fortunate thing is that we also have protocols. So even in the classes that this individual was in, there's a requirement for spacing, for maintaining physical distance, limiting close contact, other types of protocols. So even if there was a case, the risk of there being transmission within any of those classrooms is low from the beginning. So it's this multi-layered approach, which also allows us to say that this situation at Acadia, the single case remains a low risk.
Go ahead, Mike, with your follow-up.
Thanks. You touched on this a bit already, Dr. Strang, but I wonder if you could talk about how the situation that HRM went through in November and December and what's happening now in New Brunswick and the discovery of these variants all together informs the way that you and the Premier are approaching the evaluation of what to do with restrictions every 2 weeks and how far to go on that issue?
So I think overall what it does is it makes us even strengthens how careful and cautious we need to be. And in my mind, it also strengthens how quickly and strongly we would need to act if we started to see a resurgence again.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, knowing that we won't be getting a shipment of Pfizer next week and that we will be getting a limited number of Pfizer doses the beginning week of February, does that at all now that you have that knowledge, push the September timeline to have most Nova Scotians vaccinated back at this time?
No, you asked, or somebody asked that again on Tuesday, and as I said in my remarks today, every indication we have from Pfizer is that this is very short term, and even within the next 90 days, we're anticipating that what they aren't able to deliver in the next few weeks, they'll make that amount in February and March. So even within our 90-day plan, we feel by the time we get to the end of the 90 days, we'll be on track, and certainly doesn't push us off track at all with our longer-term objective, which is to have every Nova Scotian the opportunity to get 2 doses of vaccine by the end of September.
Go ahead, Natasha, with your follow-up.
Thank you. Premier, families of the Portapique shooting are calling Ottawa's temporary ban on the resale of decommissioned vehicles a positive first step, but they are still concerned you can still get decommissioned accessories and that the ban only affects RCMP vehicles and not municipal or provincial police vehicles. Wondering if government's prepared, at this time, I know yesterday we talked about it a bit, to ban the sale of all decommissioned police vehicles and accessories. If not, what do you think the solution is?
So first of all, I was very pleased to hear the news out of Ottawa yesterday. I think, like those families, it is a great first step. I know they have been championing this, particularly Nick Beaton has been talking about this as well. And I know Minister Fury was working with his colleague, Minister Blair, with some of the details. Minister Fury also would have said yesterday that we have a piece of legislation that's already ready to go and drafted to be introduced the next session that will deal with the accessories that you're referring to, and we're also looking at how do we deal with the issue of the municipal vehicles that would be in our province, that our local municipal police forces would be using.
Next, we'll go to Nabal Snad from the Chronicle Herald. Go ahead.
Good afternoon. Dr. Strang, so since the Acadia student has been in contact with people in the community after their quarantine period, I'm just wondering how public health determined that they didn't get the COVID-19 from the community, and that they got it prior to their quarantine period.
Oh, simply he was in quarantine before he came. So he came here and went straight into quarantine. So you work back through his potential exposures. It would have had to have been before he came to Nova Scotia.
Go ahead, Nabal. Go ahead.
He was not in any location that would be an exposure site because he went directly into quarantine.
Go ahead, Nabal, with your follow-up.
Thank you. So, Dr. Strang, in a previous update, you mentioned that you're in conversation with colleagues across the country about ensuring international travelers complete their isolation period. I was wondering how these conversations are going and if there are any updates that you'd like to share.
Well, it's an ongoing discussion. People coming from outside the country, they're under the federal requirement, Federal Quarantine Act, and it's federal responsibility to ensure that they are maintaining their 14-day quarantine. So we work locally. So I'll give you an example. We work very closely with our international students, with the Public Health Agency of Canada, my office, and local universities to make sure that everybody we're in agreement and how we're supporting international students as a quarantine, as an example. So it's a topic of ongoing discussion when I meet with my Chief Medical Officer of Health colleagues, with our federal government colleagues about how we continue to make sure we understand what the federal government is doing under their mandate, and make sure that there's good flow of information and where we may need then to take our own action. So it's an ongoing piece. It's an area that we've identified from the very beginning that needs ongoing collaboration and communication.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. For Dr. Strang, I'm wondering if you can help us understand a little bit more about the sequencing process that's involved in identifying variant cases of COVID. And I'm wondering if it's typical that a variant case from December would only be identified now towards the end of January.
Absolutely. If you understand, that specimen would have been submitted towards the end of December. The national lab is getting samples from across the country, and there are certain cases which are priority cases made for them. So, and so I'm not, I don't consider this all a concerning delay in us in getting confirmation. I'm not a lab expert. It's simply the sequencing actually looks at the genetic variation of the virus itself, and that's how they're able to determine it was the UK variant and the South Africa variant specifically.
Go ahead, Lindsay, with your follow-up.
Thank you. And regarding the Pfizer vaccine supply, I'm wondering that if our vaccine doses run out before more shipments arrive, which of our currently operating clinics might be put on pause, and which specific groups, be it long-term care staff or healthcare workers in a particular zone, would see their planned vaccines delayed?
So we're looking at to continue as much as possible vaccination in all sites. Some of them we may need to decrease the numbers, therefore mean decreasing the hours. But we want to, as much as possible, have all our current sites operating as much as they can. We are using, the Pfizer vaccine is what we've been focusing on in our healthcare worker clinics. But as I talked about last on Tuesday, we're now able to ship Pfizer in a thawed state to long-term care facilities. So the planning team will be working out the impacts and trying to spread those impacts as much as possible equitably across all our different clinic or our existing the vaccination sites, whether they're hospital-based or long-term care. We want vaccination to continue at some level as much as possible at all our clinics.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim. Are you there, Tim? We'll move on. Next, we'll go to Maurice Reese from the Shoreline Journal. Are you there, Maurice?
Yes, I am. Dr. Strang, many of the volunteer groups, such as firefighters and ground search and rescue, are very confused. And part of their confusion is based on the fact that sports and culture groups and actors and that can meet in practice and without social distancing with 25 people, but they've been told they cannot meet with any more than 10, but that inhibits them from holding business meetings where they need a quorum or to practice and train, but they still want to be within the guidelines and for their public image as well as safety. So is there any update on that?
So they can still continue to do all those activities in, training, etc., in groups of 10. I haven't heard a lot of concern that, they can still do the training they need just in smaller groups. If it's coming to necessary business meetings, any type of business meeting we're holding to a maximum of 10, but there's lots of ways that you can conduct business meetings, annual general meetings, things like that with virtual technology. As we're able to slowly open things up, as we continue to look at things, certainly as we open that when we're able to open up gatherings, the numbers for those types of activities will also be able to be increased.
Go ahead, Maurice, with your follow-up.
On another matter, but more down the road, as we get to winter gets over and get into cottage season and camping season, will you allow people to cross the border, say, to go from Moncton to a cottage or a travel trailer, as long as they're in isolation on those visits without having to quarantine for 14 days?
So that's a ways down the road. So if you're asking, I'm not going to speculate on what we may or may not be able to do when we get into May, June, and beyond. It's middle of January right now, and so as I say to lots of people, I think at the most 3 months, 3-month blocks of time. So when we get closer to spring and summer, that's one of the many issues we'll have to look at, and hopefully our epidemiology is in a favorable place that we can accommodate some of that.
We'll go back. Tim Bousquet, are you on the line?
I am. My apologies for that. Dr. Strang, I think you just answered the question I was going to ask, but I'll ask it anyway. When you see the vaccine rollout going into phase 3, and lots of people, 1,200, I think it was, a day or whatever the figure was, getting vaccinated. Do you see a point in that process as larger percentages of people get vaccinated that the restrictions can start being reduced?
So I think that's certainly the hope. I mean, there's still a lot we need to learn about the vaccine, especially what, if any, protection does the vaccine provide against asymptomatic infection and asymptomatic spread. But it's not just the vaccine. The vaccine is just one piece of a puzzle. We also continue to look about what is our epidemiology locally, nationally, and internationally, all of which inform what is the level of risk of COVID here in the province, or what is the likelihood of it being introduced into the province. But we certainly hope that over time the vaccine plays a role on reducing that risk, and therefore reducing the need for the COVID protocols and restrictions. But that's a ways down the road. So I think the message that all Nova Scotians need to hear is that right now, as we're beginning to roll out the vaccine, we need to continue with all our COVID protocols, all our COVID precautions, and the restrictions. This is a long journey still to go.
Go ahead, Tim, with your follow-up.
Yeah, just a clarification about the Truro school case, and I won't try to pronounce it. Did I hear you correct to say that the school is closed for 2 weeks? And also, it's been suggested to me that this is also a case of someone testing positive after 14 days.
That's not my understanding. There's an individual who's a known contact of an existing case, and tested with, as normal time frames. We would expect to see in typical of infections. And no, the school is closed until next Wednesday, January 27th.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. I'm just wanting for some more information, I guess, about the Acadia student and whether they got a test when they were first isolating, as that's not required but suggested. And I'm also wondering about canceling any in-person classes at Acadia. I'm looking on their website, but I don't see whether that's happened. And this is now the second case there this month. They're one of the only universities in the province holding all in-person classes still. If it were a public school or a factory, they'd be shut down for at least 2 weeks.
So Acadia is a big campus, and there's lots and lots of buildings. It's not like a school that has a single building. The first case at Acadia was a returning student who isolated, had no contacts with anybody else. This case, the person isolated, they did not get tested at day 6 to 8. Even if they they may well have tested negative. They only became likely infectious around day 10. So that's some of the limitations of one-time testing. They finished their quarantine like they were supposed to. After they finished their quarantine, they started to go to classes, and then they became unwell, or they felt that they needed to go testing because of their concerns about their health, and we identified them then. As I said, we're working with Acadia, local public health, to identify, in classes and in other areas who else on the university campus may have been considered a close contact. As I said earlier, earlier, because of the existing protocols that Acadia has for in-classes or in-class learning, that already that creates an environment so that people would be considered at the most moderate risk, even with another person, a known case of COVID in that classroom, which is helpful for us. The other thing we're certainly be testing all of the contacts, and we'll be working with the university campus around, there's a primary assessment center right in Wolfville, and certainly be looking to have already people are looking at making sure that there's appropriate and increased capacity through that PAC over the weekend to accommodate what we expect a surge in testing of people just concerned and wanting to come forward and get tested, and we encourage that. We've learned in Nova Scotia that one of the key ways to stay ahead of this virus in any situation, whether it was our general community or a location like a university or a workplace, one of the key ways is to get lots of people tested very early on.
Part of your question, you said we would be closing public schools for 2 weeks. That is not always the case. It depends on what we see as the potential risk to those students. But we've had some cases where we've closed the school for cleaning for a few days and then reopened to the population. And the same thing with some businesses. Each one is assessed on their own, and it always comes down to the risk of that virus being able to be passed on.
Go ahead, Victoria, with your follow-up.
Okay, thanks for that. And I'm wondering, the Coast had put in a request to the province about the new ArcGIS system that was announced on Tuesday, but they didn't want to set anyone up with an interview, so I figured I'd ask here whether you can give any details on how much that's costing us per month or the contract cost in total.
I don't know what system you're referring to, I'll be honest. So,
sorry, the new data website.
Oh, for our immunization data, I don't have an answer for that question.
Next, we'll go to Alec Martin from The Signal. Go ahead, Alec.
Thank you. I have no questions at this moment.
Great. Thank you very much. That's all the time we have for questions. Go ahead, Premier.
Thank you, Tina. Lots of people have been asking me how I'm doing, and today I'm wondering how all of you are doing. This has obviously not been easy on any of us. We still have lots of restrictions. We still have cases. Today we saw how some of them are more complex than others. And I don't know about all of you, but it can be tiring both physically and emotionally. But it is, at this point, though oftentimes where complacency sets in, where we just say we've had enough. But we can't let that happen. We've come too far, and we're doing really well. I couldn't be more proud of the people of this province. We've asked you for the last 10 months to follow the protocols, wear a mask, keep your distance, stay home if you're not feeling well, isolate if you're traveling, all of these restrictions, and here you all are doing your best to follow the rules. Now, with 2 cases of variant COVID-19, hopefully here and gone, now more than ever, we have to hold the line. We need to continue to follow the public health protocols as we continue to roll out our vaccination program. Some of you may feel that it's too slow, but it's steady. And I will continue to push to ensure that we have a consistent vaccination program across our province. I just asked you how you were. Obviously, you can't answer, but my hope is that you're doing well and doing okay, and that you're supporting one another, checking in on neighbors and friends and family, and that you're doing it and offering kindness, as I know that you do so well. It's been one of the hallmarks of our journey in the last 10 months is the kindness that we've shown to one another. And I want to thank you for doing that, and I want to ask you to continue to do that. I hope you stay safe, and I want you to know I am thinking about you, and I want you to have a great weekend.